My name is Scott Stevenson. I'm the President and CEO of Phoebe Ministries. Again, we appreciate your being here. It's a real honor for me to introduce our next speaker. Since joining the United States Senate in 2011, Senator Pat Toomey has distinguished himself as a leader on economic, financial service, and budgetary issues, striving to restore fiscal discipline to Washington and the economic opportunity for all Americans. Senator Toomey previously served in Congress as a member of the House of Representatives for Pennsylvania's 15th Congressional District, where he championed economic growth and fiscal discipline. Honoring his 3-year pledge, he did not seek re-election in the House in 2004. Senator Toomey is a true advocate for Alzheimer's and dementia care and a member of the bipartisan Alzheimer's caucus. Ladies and gentlemen, please welcome United States Senator Pat Toomey.
Thank you very much. Scott, thank you very much for that kind introduction, and thanks to Phoebe Ministries for hosting this conversation, this conference. Thanks to DeSales University for providing the forum here and participating. I appreciate the chance to share some thoughts with you about this. As Scott mentioned, my usual wheelhouse in the United States Senate has been a focus on economic policy and trying to promote a series of measures that will help restore stronger economic growth, greater opportunity, rising standards of living. So I spend a lot of time focusing on economic and fiscal policies, but there are a few areas totally separate from that, my typical wheelhouse, that I've decided to put a lot of resources into, personal energy and time and legislative efforts, because I just think they're so compelling that they call for that effort. One of them is a series of measures to help improve security for kids in various environments. A second is a series of measures that I think will help veterans, especially veterans returning from recent active duty in Iraq and Afghanistan, to help them in a variety of ways, including just reintegrating into civil society and obtaining the work that they want to get back to. But the third of these three areas outside of my usual economic wheelhouse has been my interest in Alzheimer's. And so I'm delighted that this conference is happening here in the Lehigh Valley. I'm delighted to have been invited. And I want to just share a few thoughts with you. For many of us, probably all of us, at some level, somewhere in our family, we've been personally affected by this. So my father was diagnosed with this, and I'm sure that most all of us know somebody in their family who has been. And that kind of brings it to the front burner and piques a particular personal interest. It's an epidemic, I think. It's fair to say at this point. The scale of this disease, the breadth, the number of people afflicted is really astonishing. And, you know, it steals people's most precious possession, your memories. And, of course, it doesn't stop there. It's now a leading cause of death. The numbers that I've seen, you may have seen more recent figures, but my understanding is about 35,000 people have died in Pennsylvania over the last 10 years. We probably understate that number significantly because people die from other immediate causes, but the underlying cause was Alzheimer's. I would argue this disease is unique in its severity. It's unique in several ways. It's 100% fatal. We don't know what causes it. We have no cure. We don't even have a treatment. And it'll affect almost everyone if you live long enough. There's no other disease that has that set of circumstances. It's estimated that 5.2 million Americans in 2014 have the disease. Almost 500,000 new cases this year alone. Someone new is diagnosed every 67 seconds. And the personal cost is just staggering. The financial cost, by the way, is also staggering. The estimates are that for the federal government alone, this disease costs something on the order of $200 billion a year. And that doesn't even count the personal costs, right? The lost work hours for victims and their family members, the out-of-pocket costs of providing care for people. It's staggering in its scale. So I understand that every disease is extremely important to the person who's afflicted by it, and understandably so. But I think the breadth, the lethality, the severity of Alzheimer's puts it in a category of its own. So the good news is that have been, in my view, we've been increasingly addressing this problem in a variety of ways that are very constructive and very important. There's certainly increasing awareness and an increasing sense that we need a plan for how we're going to find a cure and help people deal with this disease until that time. I know you heard from Secretary Duke earlier today as he described Pennsylvania's state plan for Alzheimer's disease and related disorders. I want to commend Secretary Duke and Governor Corbett for recognizing the importance of Pennsylvania having a plan and for having taken the steps to put one in place and to begin to execute that. And I want to applaud everybody who's here today, participating in this conference that is going to enhance awareness and understanding, and in that way contribute as well. Let me share with you some of the things I'm working on in the Senate, because there are, I think, really important things we can do, not only to raise awareness of Alzheimer's, but also to commit to finding a cure for this disease. So I joined the Congressional Task Force on Alzheimer's disease. That's a bipartisan, bicameral group of senators and House members who want to elevate this, the profile, the attention that we give, and the resources that we devote to combating this disease. I also think it's very, very important that we play a very supportive role in the research and the funding that is happening through the NIH, and make sure that that's adequate. And let me talk about that a little bit, because I'm not convinced that it is adequate at this point. So I start with the premise that our response to a disease like this needs to be proportionate to the disease itself, to the threat, to the reality of this disease. So I asked Dr. Collins, the director of the NIH, to come to my office. We sat down, we spent a lot of time together talking about how the NIH goes about allocating its resources and fighting a disease like this. Just so that you know, the NIH budget, it's about $30 billion a year at current levels. Only about 1.7% of that budget goes to Alzheimer's research, which was shocking to me. That 98.3% goes to other things, many of which are completely worthy of some level of research. But I wonder about some of the proportions. So diabetes gets about 5%, HIV/AIDS gets 10%. There are many diseases that either never were or no longer are fatal. They've become manageable chronic diseases, and yet they get several times more resources than a disease that is just so devastating and so prevalent. So I think we need a national conversation about how we go about deciding how to allocate what are always ultimately somewhat scarce resources. I'm not an advocate for having Congress decide what's the disease of the month or the most politically appealing disease to contribute to this election cycle. I think that would lead to really bad outcomes. And I have a lot of confidence in the professionalism of the people at the NIH. But they do operate under general guidelines that Congress approves of, and Congress has an oversight responsibility. So again, this shouldn't be a political process. We should put politics aside, but we should be willing to address whether or not we have the optimal allocation of resources right now. One of the things that Dr. Collins and I discussed were some of the unique challenges that Alzheimer's does present. And one of the things that I took away from that discussion, and he made a very important point, and that is, in a disease like this, where we really know so little about its cause and have no idea of a cure, sometimes the more fundamental general research that can be done about the brain has to be a necessary sort of foundational exercise that we go through. And that may not be categorized as Alzheimer's research per se, but it might inform and inspire and lead us to Alzheimer's specific research. And so I think in fairness, we need to consider some of the work that's being done that could lead to this more directed Alzheimer's research. So for instance, there's the interagency initiative to map the human brain. $100 million invested this year, another $200 million planned for next year. And this, I think the folks at the NIH rightfully believe that it has the potential to replicate the success of the Human Genome Project for a different set of diseases. And that's very exciting and that's important. There's also the Accelerating Medicines Partnership, which is an NIH initiative where pharmaceutical companies are collaborating with universities to develop new therapies. $1.6 billion in funding for the National Institute of Neurological Disorders and Stroke. So again, these are not specific to Alzheimer's, but they might very well contribute to our understanding over time for a disease like Alzheimer's. But having said that, I still think there is a need for a national discussion about the criteria we use for allocating federal resources for fighting diseases. And I think that Alzheimer's is in a category of its own. And that's one of the reasons why I have I've co-sponsored another bipartisan initiative. It's the Alzheimer's Accountability Act. So back in 2010, the National Alzheimer's Project Act was passed unanimously. I appreciate your patience in my dealing with these different legislative titles, which can be confusing. But the bill that already passed, the bill that passed in 2010, instructed the Secretary of Health and Human Services to develop a national Alzheimer's plan to prevent and effectively treat Alzheimer's by 2025. So that was the mandate of that bill. The plan came out in 2012. It gets updated annually. But I think it's missing an important part. And what it's missing is an assessment of what it's going to cost the various responsible agencies to actually successfully implement the plan and to succeed in this. Goals that are laid out in the plan are very important, goals like improving testing, increasing enrollment in clinical trials on promising drugs and lifestyle interventions, expanding epidemiological research. All of those things are important, but I think it's necessary to quantify the cost and to make sure we are then funding these goals. So my legislation, the legislation that I'm supporting, complements this plan by requiring the director of the NIH, and the NIH supports this, but requiring Dr. Collins or his successor at the NIH to offer an annual budget estimate to Congress and the President on how much it's going to be necessary to reach the goals that are set by the National Alzheimer's Plan. In my view, having the plan is necessary, it's important, but it's not terribly helpful unless we actually intend to implement it, and we need to know what that's going to cost. This, I think, is the right way to do it. Let's get a professional estimate of what this would cost from the very people who would be implementing some of the most costly aspects of it. There's another element, another bill that I'm a fan of, I've supported, is designed mostly to raise awareness. It's just authorizing the post office to raise some money by doing an Alzheimer's stamp. Other diseases have had stamps, and it raises actually many tens of millions of dollars. Breast cancer alone is over $75 million has been raised. All of the money will go to NIH, and it's not a massive amount of money in the scheme of things, but it's not trivial, and it does raise awareness. There's another bill that I feel strongly about. I introduced this as an amendment during the budget debates that we had last year, and that's a bill that would restore the deductibility of health care expenses for families that are coping with high costs of long-term care. So prior to the Affordable Care Act, a family that was incurring high out-of-pocket costs for medical care, caring for someone who was chronically ill, they could deduct the cost of the medical expense as soon as the cost exceeded 7.5% of their family income. So anything above that you could deduct. Unfortunately, in the Affordable Care Act, the threshold was raised to 10%. So you can't deduct any of your expenses unless and until they exceed 10% of your family income. It amounts to a $30 billion tax increase precisely and exclusively on families who are coping with unusually high medical expenses and the cost of caring for people with expensive medical diseases. I just don't think that's a good idea. I just don't think that's good policy. It disproportionately affects lower and middle income families, and although my amendment was defeated, unfortunately, during the budget consideration, I'm going to bring that up again, and I think at some point we've got a shot at prevailing in this. So that's just kind of an overview of some of the sort of wide-ranging ways in which I think, as a senator, I can help to advance this cause. But I acknowledge that what we do in Congress is small compared to the work being done every day by the caregivers, by the researchers, by volunteers all across our country, certainly across the Commonwealth, who are on the front lines, on the battle lines in this disease. And so I really appreciate those of you who are caring for somebody who's afflicted with this disease. I really appreciate the research that's being done. You know, I had a chance to visit with Dr. John Trojanowski's lab at the University of Pennsylvania Memory Center. They're doing some amazingly sophisticated and really important work, and that was exciting to see that happening right here in Pennsylvania. We have over 650,000 Pennsylvanians who provide unpaid care for family members, friends who are afflicted by this disease, and just an innumerable number of volunteers who are doing so much. My family and I were at the Philadelphia Walk to End Alzheimer's last November, and tens of thousands of people who came up. It was really very inspiring and heartwarming to see it. So these are the really irreplaceable and really important work that's being done to combat this terrible disease. And I hope that our work in Congress will complement the great work that's being done across Pennsylvania and across